Monica does it, and then also how Kaiser does it, and then we're gonna do the cross-table lateral knee and Rosenberg, and we will be done. Any questions so far, guys? Any questions? You guys look kind of like, I have to know all of that after lunch. And I was in clinic all day. It's okay. You guys will get this by the end of the day. Trust me. Watch out, mister. Thank you, sir.
Even though like said like that won't go away, but it's basically one of your options. You're gonna do like sunrise or like a tangential patella. So it's kind of like a reverse of what Rosa just taught you guys. Like from that side, the IR is over here and you're going to angle up, right? So now we're shooting from this way, you're going to angle down. That's it. Relax your knee a little bit. Yeah. You're still typically going to use like a smaller IR, but because like we have to build it up and all this stuff, so I'm just going to use a big IR so that we can make everything a little bit faster, you know? Then it's going to be coming down a little bit closer to your position. Probably around right there. And then you just pull this outside a little bit. And we'll bring a little bit up there. And that's it. That's basically how there's one of your options if you want to do a sunrise knee or a reverse. I don't really know that there's going to be a name for this one, but this is one of the ways you can do. And then we're also going to have kind of like a Kaiser way.
So what you can notice
Are you coming this way?
RD and the SID.
You're coming this way?
Yeah.
Doing this
Yeah.
one. And the projection is magnified, but not crazy magnified as it should be, because it's playing the trick with the distance. So that's why it's accepted in the hospitals, okay?
Alright. And then for the next one, I was suggesting that to do the last one like on the chair so that it's not as magnified.
Whenever you think it's
Yeah.
best. So you want me to do the cross-table lateral now, Denise?
Do you want to cross it one?
Okay.
Yeah, yes.
So there is one more way, the Kaiser way, that I'm going to show you in a minute, okay? So
I think she's gonna do the cross table first and then that one.
We're gonna do the cross table knee now, instead of like the Kaiser way, because like he's already on the table, you know. So we're gonna show that later.
So when you resource to do cross-table laterals, it's typically done because the patient cannot assume the normal position, okay? So the cross-table lateral knee is done to check fluid levels or to assess for injury like fracture. So some facilities want you to do a little angle of the knee, like flex the knee a little bit, and some facilities just want you to choose flat. I'm going to show you both ways because it's important that you know both. So I'm going to be doing the right leg, and I'm going to elevate the leg here, and notice how I'm placing the sponge in my leg. I'm not putting it, lift that side a little bit. I'm not doing this. You see this? I'm going to lift that and put at the edge here of the sponge. Why am I doing that?
So place that.
Very good answer, yes. I'm going to place the IR back over here because my projection, my tube is coming from here to here. Now, when you work with patients and you're going to be putting anything between the legs, you have to work them because your detector is quite big and you might have to shovel this up high and get very close to their personal area, okay? Sir, so I'm putting a device here between your legs. Sorry if this bothers you, okay? I'm just going to go up high a little more, a little more. Very good. That's enough. And then I'm gonna bring the leg as close as I can to my image receptor. Okay? Once I do that, I make sure that this don't flip, okay? Because sometimes this will flip and it will cause a lot of pain. So you wanna use tape. Okay. Okay. Oh, that's a good peg. So you want to secure this because this will flip on you, especially if you have to do what I'm going to do right now. So my SID is too short, so I'm going to just kind of do this, and I'm going to move the, thank you, get at least 40 inches away. Okay? That's good. That's about right. So I should have at least 38, but that's as far as I can get, so that's okay. You can always push the mattress and whatever. But just remember to compensate with techniques if you were in the real environment. So, what am I going to center? Can you go? Oh, never mind. I got it. That's good. So the centering is going to be at the base of the apex, but my IR has to be centered and aligned to my image receptor here. Notice how I'm not going over the margins of my IR. You not do this. See the light on her shirt? See the light over in the over there? You have to be very careful. So collimate to keep the margins within the image receptor. Okay? And then you put a marker here. It will be your right marker. I don't have one. Right marker. And then you must do
I just put that tape on
Oh,
now.
thank you. And then, if you're able to, you can have a marker out there that will say cross table. Okay? So that's how you do. Now, there's another way that, like Sentinella, they like to do this a little bit different. May I have this? Can I remove this from underneath, sir? And what did I do with my 45-degree sponge? Can I have one? There we go. Just, and yeah, that one will be fine. So what they do, see the pointy thing, the pyramid? That's going to go underneath the joint of the knee. Go ahead and bring your leg up for me, sir. And bring it down for me. So this will put, you're hoping that this will flex the knee a little bit. But this is only done if the patient is able to do it, and if the facility is a requirement, because sometimes patients are not going to be able to bend it slightly. Just put a little. So that's another option. Depends where you are, where you go to your clinic. Now, when you work on this, keep an eye on the patella, because you can be doing this and you're not going to get a nice lateral. So you want to keep an eye on the patella and make it as perpendicular as you can to your image receptor. Any questions? No. So you might see it both ways. So just for SIM, Ms. Sharman said depending on the patient, that's the